Good morning, ladies and gentlemen. We are starting almost on time, and we're very keen for today's program to begin because we're starting with very honorable guests and keynote speakers. So as you do pour in, please pour in quietly. And I look forward to kick off the second day of the ICT World Conference with you today. For those who are here for their first day, yesterday the conference started, but for those who just came for today, my name's Sunny Grunewald, and I will be leading through the program of this main stage. So yesterday was about vision, direction, and courage in many ways, and what the future holds, the promises, the challenges, the opportunities. Today, in many ways, we will dive deeply into how to really face uncertainty, complexity, and how to lead change in environments where it's not always quite clear how to do that best. But what's always certain is that doing nothing cannot be the answer. And so, how do we navigate that is something we will explore today through various keynotes. As leaders, we all need to find ways to navigate, and leadership is also something that will be highlighted today in multiple ways, be that across regions, organizations, or even populations. This audience brings together a unique mix, private and public actors, the healthcare sector as a whole, those who deliver care, the specialists, those who make the system work administratively, and that is unique, particularly that it's from the private and public sector. And so we begin with leadership at a national level. I'd like to welcome someone who's today in his home turf, as I was told, as a trained pathologist, but also as His Excellency, Minister of Health, Welfare and Sport, Jan Anthonie Bruijn. Welcome to the stage, and thank you for supporting ICT&health World Conference.
Thank you very much.
Thank you.
Thank you. Good morning, everybody. It's an enormous pleasure for me to be here and to be allowed to kick off this wonderful second day of what I consider to be a very important international congress on the cutting edge between ICT and health. And let's start with today's turbulent world, a world in which Europe must make its presence felt more than ever. And I would like to start off with a question. Which moment in history do you think is most like the time we live in now? And before you all start answering, AI influencer Seggy, I'm sure you know him, he asked these interesting questions to ChatGPT. Which moment in history do you think was most like the time we are living in now? And you can find the clip on YouTube if you don't believe me, but Chat's answer was the year 1453. I'm sure you all know what happened in 1453. It was the year that Constantinople fell to the Ottomans, marking the end of the Byzantine Empire. To Seggy, this didn't really sound very encouraging, but then Chet explained the world at that moment did not end, it reorganized. Today we call it disruptive innovation, if you wish. And Chet summarized an incredibly complex situation in 6 words, superficial but also quite neat. Starting from that notion of great change, let's zoom in on this conference and the digital transformation of healthcare. To do that, we need a broad outlook, the ability to put things in perspective, and a positive mindset. Because we must not let ourselves be swamped by such a wave of change. On the contrary, we need to embrace it and channel it into the right direction. This year's conference, I believe, is more relevant even than the previous episodes. Digitalization helps us to keep good quality healthcare accessible and affordable. Great challenges these days in our country and in many Western countries. Lightening the workload for healthcare staff, simplifying administration, and doing much more in less time. And this frees up time for care providers to take care of their patients and to give attention to their patients at a personal level. So I don't believe that the personal touch is being lost by increasing ICT and healthcare. I believe there's more time for personal touch. And I'm a doctor myself. And it becomes easier to deploy staff in areas of healthcare where they can make the greatest difference. I'm a pathologist by training, it was already said, an endlessly fascinating job. I don't know if there are any more pathologists here, but peering through a microscope, I always feel like a whole new world is opening up. It's pure art. Many decades ago, talking about leadership, 40 years ago, my professor then, Philip Hoedemaker, he was sitting behind his personal computer, those days, you remember those big things, and he thought, pathologists, they look at biopsies from living patients. Every pathologist maybe 100 per day average. All these observations are put into reports. The report is the basis for the diagnosis and the therapy and the whole further treatment of the patient. So is this tumor benign or is it malignant? Those are the questions we have to answer based on sometimes even one cell. And all those reports are being sent to the colleague who is treating the patient, the surgeon or anybody. But Philip Hoedemaker, 40 years ago, it was the very beginning of internet, he thought, well, let's put all those reports into a central database, 30,000 per day already in our small country, 40 years ago, 30,000 reports per day, so that with every new biopsy that a pathologist is seeing, is faced with, on his screen he can see all the previous reports from that same patient of at least pathology investigations that have been done on that patient. And he realized that. It was the EPD, the electronic pathology dossier. I know that EPD means something different for some of you. It's traumatic even, but it was the electronic pathology dossier, and he called it PALGA. And he was ahead of his time very much, and since then, and I worked as a pathologist for 40 years, with every biopsy that I got from a patient, I already could see all the previous reports from that same patient. So if I get a strange lymph node from a patient, and I see some cells, and I think, what are those cells? Could there be a metastasis from some tumor somewhere? A typical question to be asked to a pathologist, 100 times per day. And I see on my screen that, hey, this same patient, 5 years ago, somewhere else in this country, there was a small mole taken from him or her, and that could be malignant, so this could be a metastasis from that mole. So now I don't have to do all kinds of investigations on that piece of tissue to find out what these strange cells are, but I can go directly to the question, are these mole cells, are these metastasizing cells from that mole from 5 years ago? So I can work much faster, I can work much cheaper, I can render much better results. And as pathologists, we have been doing this in our country already for 40 years on a daily basis, increasing the efficiency, the quality, and everything in our profession to the benefit of the patients. But also, just imagine what a kind of database we are talking about by now, and still every day 30,000 more diagnoses are going into it. But also for research, we are using it on an enormous scale, and also researchers from all over the world are coming to our country to use this database. Because I can ask the question of this database, okay, give me all the breast cancers from the last 5 years, or all the inflamed kidney biopsies from the last 5 years, or from patients above 5 years or below 5 years of age, or whatever question you want to ask, and you get those questions. So it's also an enormous source for research. thanks to this one visionary man, Philip Hoedemaker. I think by now, these days, it would be impossible to realize it because it would simply be forbidden by the laws and the privacy issues, but as a minister, I will not further comment on that. And now, in our profession, in pathology, we are digitalizing. So the microscope is already almost out of the room, and we are looking at digitalized, because we can digitalize all those slides. I was a kidney pathologist in Leiden for 40 years, and I saw about 100 biopsies per year. My successor now is a kidney pathologist for Amsterdam, Leiden, and Rotterdam, thanks to the fact that he can look in a digitalized way on all those same issues, all those same pictures from biopsies that I had to look at through a microscope in a physical way. So it doesn't matter where he is, he can do it. So he is seeing 3 times more kidney biopsies than I ever did, increasing his quality by many, many steps, and also, of course, the efficiency. So, and as we speak now, AI is being introduced because it's my profession is pattern recognition. So, of course, this is ideal for AI, just as radiology, for instance. And I'm sure that this will render even much better results in terms of quality, et cetera, et cetera. So it's going very fast, and it's very nice. And also, we have an enormous shortage in our country of pathologists, so we can also face that problem with introducing AI, thanks to digitalization. And this, of course, is just one of many very inspiring examples, all to the benefit of in the end, the individual patient. In more and more areas, digital innovation will help keep healthcare going with fewer staff and improve it at the same time. Right now, we are in the midst of a major push to improve efficiency. It's up to us as administrators and healthcare professionals and politicians to ensure that these innovations are deployed effectively, carefully, and at the right moment, and also in a safe way. Medical data is about people eventually. Individual privacy is a big factor here. Take microscopic samples of tissue, my job, they belong to people of flesh and blood, they are even their property, and they remain even their property. And they divulge all kinds of sensitive personal data. There's DNA in those tissues that we also take out and we investigate on a routine basis. Data must always stay confidential, so how do we deal with that? At the same time, healthcare workers need to be able to share data so as to provide good quality care efficiently. The European health data space has great potential in this respect. But that alone is not enough. We also need to scrutinize the way we work in practice. I don't think anyone's ever counted how many IT systems there are already in the Dutch healthcare system alone. But it must be a head-spinning number. Every hospital, every home care nursing service, every pharmacist has their own system, and we are currently working, of course, to harmonize those, and that's going very well, but it is a challenge, and I also see it in my profession. We are not there yet. So this is a time when Europe needs to show what it's made of, in many ways, and when it comes to healthcare, and at the same time uphold its values and principles, in the interest of patients and staff. We've already made good progress, of course, but now we need to speed up, while bearing in mind that it takes time for innovation to become established. Let me take you back in time. Hundreds of years ago, the invention of the microscope was revolutionary. It burst on the world rather like information technology has done in our day. Back in the 16th century, Dutch lens makers had worked for decades to make lenses stronger. The most famous of all in our country was Anthonie van Leeuwenhoek. He produced a lens so powerful in that little shop in Delft where he worked, that he could see life forms, things that seemed to him like tiny creatures. He saw them for the first time. He was the founder of microbiology. And we now know they are bacteria and blood cells, but Van Leeuwenhoek was seeing them for the first time. They did not even have a name yet. And at first people thought he was crazy. But after many years of describing his findings and perfecting his microscope, Van Leeuwenhoek managed to convince fellow scientists that he was right, that he was looking at biology, microbiology. Looking back at that, it's fortunate that Van Leeuwenhoek stuck to his gun. He did not give up, even though everybody thought he was crazy. It meant that the microscope came into being within the space of a single lifetime, and I just told you what it meant for my profession. But it took a lot of time, and it took a lot of effort. And that's the thing, innovation is about more than just new technology. It's also about humans. It's about collaboration, determination, and our behavior. And there's nothing new about that, let's face it. Immanuel Kant once said that the proof of intelligence is a person being able to ask the right questions. Someone like AI influencer Segi. Today, we too are asking ourselves and each other questions, and that's the way forward. Questions like, how can we capitalize on the opportunities presented by the European health data space? How can we speed up the digital transformation so as to cope with looming staff shortages and ensure that a career in healthcare remains as attractive as it has always been? And most importantly, how can we work together to achieve this great change within and between organizations, regions and countries, and of course at the European level, and also between the public and the private sector, the secret of this meeting here, while maintaining the high quality of our health services, but also keeping healthcare universally affordable and accessible for our citizens. I call on you, where possible, to join with others in stepping up the pace, and this wonderful Congress is a place to do it. We can't afford to waste time. Our well-functioning, stable healthcare systems are something to be proud of, but they are under pressure. Let's show the world that we can lead the way here. And please remember, nothing is impossible, because impossible things have never happened. Thank you.
Yes, please. Thank you, Minister, for these words.
Thank you very much.
Very inspiring. As you look to the future, we are at the ICT&health World Conference. We're so grateful for your support as a ministry. As you look to this question and this intersection of ICT and health, you spoke a little bit about the future of your profession and where it's going, but could you paint the picture a bit more detailed? Where do you really think, as a pathologist, training and working in this field for, I think you said 40 years?
Yes.
Where is it headed, and what are you personally most excited about in this intersection of ICT and health?
The fact that we won't need pathologists anymore very soon.
Is it?
Yes, it's true. It's going so fast, and of course AI can do this pattern recognition that we do much faster and much better and much more standardized and cheaper and 24/7 to the benefit of the individual patient. So I do believe that pathologists and maybe also radiologists, at least part of there are also intervention radiologists, of course, although even that may be digitalized. But so things are going very fast, and the speed limiting factor is the human mind. So that is the challenge.
That is the challenge. So how do we upskill? We had a conversation yesterday on stage about upskilling and deskilling, and the tool of AI potentially, leading in some ways, depending on how you use it, to both. How does one as a ministry think about upskilling those whose profession is changing most profoundly?
Well, as a ministry, of course, we can only support. We can make the way, we can take care of good legislation that gives space. Because before you know it, we are in the way, and we are only making things slower. For instance, if the legislation that is here today would have been in place 40 years ago, at the time of Philip Hoedemaker I talked about, then this PALGA database would probably not exist, as I said. So, looking from the ministry, that is exactly the challenge. How do we position ourselves in such a way that we support and give space and are not in the way? And this Congress is, I think, a good example. We are very happy to sponsor this Congress, to be here. And
We're very grateful for the partnership.
but the people that are doing it is not the ministry and especially not the minister, but of course are the workers in the field, the technologists, the nurses, the doctors, and the patients themselves, who have also let us know through their patient organization that they want more digitalization, especially in the first line of our healthcare. Very interesting, I think. I would not have expected that, because sometimes you think, well, aren't we going too fast, and can our patients follow us? But a recent survey showed that the patients, at least a great majority of them in our country, they demand more digital services in healthcare, starting with the first line, the general practitioner. They prefer to be home and to be served in a good way, and only to be forced to go to the hospital or the primary physician if it's really necessary. So maybe the patients are not even the problem, maybe we are the problem. But my job is to take care that the legislation is at least not the problem.
Well, we feel very fortunate to have someone in charge who is thinking about it in this way. And if you could give the health sector as a whole, which is you mentioned it's a rare occasion that everyone's in the room, that you can really talk to the system, if you so will. If you could give one piece of advice, what would it be?
Enjoy the fact that you're working in the best and the most inspiring and the most, well, it's my job to say that, but I also believe it as a medical doctor. I've worked in this profession for 40 years every day with enormous enthusiasm and fun and pleasure, because when you're working in healthcare, if you're a minister or a medical doctor, a nurse, or somebody taking care of a hospital in the administrative way, we're all working for something that you don't have to ask yourself, is it important? Because we give happiness and life and health to people of all ages, and that is a present that you give to somebody else that is worth more than any words can say. So that for me has been an inspiration from the time I was a medical student till the moment I'm sitting here with you now. That's what we do it for. And I don't have to tell that to the people here, because it is the inspiration for everybody working in the healthcare. But it is an everlasting inspiration. And the other thing maybe is to look back in history, always to learn from visionaries like Anthonie van Leeuwenhoek or Philip Hoedemaker, the people who really, and see how they did it. And to see that everybody thought, that's a crazy guy, sitting the whole day behind the computer or with lenses behind the microscope. But they were the groundbreakers. And maybe there have been many more groundbreakers that stopped because they could not face the pressure. They could not stand that everybody thought they were crazy. So they thought, well, let's put it away, you know. So let's go on and dream and work to improve healthcare accessibility and quality for our patients.
Minister, thank you so much for your words, for your encouragement, and for your inspiration. We really appreciate it.
Thank you very much.
Mr. Bruijn, thank you.